SACS basically enabled a person to feel good about themselves, to once again have hope about themselves. And so that really summarizes to me what SACS does. It gives people hope, the sense that I have a partner out there in life, that I can indeed face the challenges I meet and move through the experiences that are in front of me.
We do have a motto at Loma Linda that says that to make man whole, and this by this we mean spiritual, mental, and physical.
That kind of opportunity to have a multidisciplinary outreach is unique in SACS.
It is the only place on campus that a student can literally take a patient by the hand and say, okay, you're here today for your high blood pressure, but I see you have a problem with your teeth. Let me take you over to the dental clinic and see what they can do for you there. Or take them by the hand and say, you really are having a problem with your marriage, or with the behavior of a child, or an addicted spouse. Let me take you over to behavioral health and talk there. Another service that's just coming in now that I'm very appreciative of is the School of Pharmacy has come in and starts providing a pharmacy faculty. So instead of just saying, here's your prescription, hope you can get this filled, you need to take this medicine, the student can literally take them to a pharmacist and who can sit down and say, okay, this is the way this medicine needs to be taken. If you can't afford this, here's an alternative. Here's the best way to work out the kind of medication needs that you have.
We can actually give them the medication before they walk out of the door to ensure that they're able to get their medication.
Most of our patients can't afford their medicine because they're either uninsured or underinsured. So what we have here is a program that helps them get the medicine for free or for a discounted cost.
So we have the meds delivered here, we store them here, and then patients come in and pick up their medicines on a regular basis.
For the university, SACS is an incredible opportunity for teaching.
So we have medical students that go through here, various behavioral health students, dental students, and obviously pharmacy students. All are able to come here and rotate through here and see these patients that need such dire help.
Dentistry related personnel who are going to graduate through the university will be coming through this clinic, which is, I think, says a lot for the commitment of the university and the School of Dentistry to SACS.
What does the antibiotics do?
What
do you call that disease if it's the thyroid's attacked?
It's Graves, right?
No.
No. Or
Autoimmune? Yeah. Is some kind of autoimmune. Okay.
I think that the more students we bring through what is considered a mission site for the university, and the greater the exposure to working with the underserved populations, the more well-rounded a professional will be.
The Compassion Clinic is directed by Dr. Mark Carpenter, who's on our dental faculty here, but is really in private practice in Redlands.
We're here to try and serve the prodigal sons and daughters, but they've got a tough road to pull, and some of them were born into the most difficult of circumstances. We don't judge them in any way, and so you'll see some extraordinary things.
The Compassion Clinic is really a kind of a safety net for people with no resources.
Loma Linda is very much of the desire to teach the students about their responsibility to help the poor of the world here and in other countries. And the students that participate at SACS Clinic, at Compassion Clinic, all have a positive thought, and their experiences are incredible.
The Good to Grow program is one recent one that of the kind of programs that we seek external funding for. Good to Grow has been funded by what's called First Five, which is actually tobacco tax money in the state of California that supports innovative programs in the community. And I like to think of Good to Grow as basically an executive health program for children. So they come in and they go through a full assessment, psychological, physical, all the different issues that are evident in their lives, whether it's safe at home, whether parents have the skills they need to help them, and so on. And then they're given a roadmap in terms of here's how to pursue a healthy life for this child. And we're fortunate to have First Five be willing to fund that, so we can really make a comprehensive program and provide a kind of a roadmap into the future for each child that comes into that program.
SACS Norton Clinic is a champion of the community, and they really go out of their way to provide incredible health care.
Children basically aren't left behind, so they can get into school, and it's for here their children legally or illegally. It's a self-certification program at first, and then they're able to have different stops when they come in. They're able to get primary care, they're able to get behavioral health, and they're able to be referred over to dental services.
We give them a passport, we take their picture, we give the parent the passport with the picture inside as a tangible way for them to be, following along in the program.
If children are healthy, they are more ready to learn at school, and that's really a big part of why First Five exists. And that's why this particular program makes it so important, because they address 4 critical elements of a child's health. First Five can't do it alone, SACS Norton can't do it alone, Loma Linda can't do it alone. And we see the needs in the community, and we care about health care for kids. I think that the community needs to know that we care about it, that we want to address it. We just need help in how we do that, so that way when they get to kindergarten, they're flourishing, they're the best kindergartner they can possibly be, because we made a difference in their health care early on.
Pursuing a dream like SACS is a challenge. It's not easy to maintain something. The easiest part is having the idea and perhaps even starting it. But trying to keep it going year after year is the challenge in any sort of an operation like this. And when the chips are down, when the struggles come, people rise to that and say, I believe in this, this is what I want to be doing with my life, this is why I'm here. Any part of a program that somehow gives you hope is a significant part of putting your life back together. And I hope that is what SACS has done for many thousands of patients through the years.